Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Today, we are on the beautiful, sprawling campus of the College of Staten Island for the final chapter of our visit with Northwell's Director of Global Health, Dr. Coie-Peña. Dr. Coie-Peña is an emergency medicine physician and leads Northwell's mission to raise health on the international stage. We begin with Dr. Coie-Peña's expanded thoughts about the term mission versus medical mission. He describes how Northwell's approach to mission protects local economies. He touches upon Ukraine and concludes by challenging health systems across America to rise up and raise health. Give a listen.
Let's briefly talk about that, the word mission. There's some key terms that we use that kind of just use to invoke an action of what we're doing, but there are certain words, and I'm guilty of it myself, of using the term mission.
Yeah.
How do we have to be careful about things that when we're using terms?
Yeah, so when I reference mission, I'm talking about the mission of the health system, which is very different than the term medical mission. And the term medical mission in my world is kind of a dirty word, because medical missions are usually described as, you fly somewhere, you set up a health fair or a tent for a week in some rural area, you don't tell the government you're coming, you treat some patients for diabetes and high blood pressure, you give them free samples of 30 days of medication.
Feel good about yourself.
Take a lot of pictures, and then you leave. And so it's very much one-sided. It's very much about the experience of the US-based practitioner going and giving back. And that, there is value to that. I don't want to poo-poo the value in somebody who's,
heart's in the right place.
Yeah, their heart's in the right place. They're slogging it out here in New York, and they feel different about providing healthcare in another country, and that's a good feeling. We want to keep that good feeling, but change the trip so that it's a sustainable trip. You don't want to diminish the feeling that people have when they're visiting kind of other countries and delivering healthcare. That we want to harness that, but we want to change kind of the other side of this, what the host sees, so that this is part of, instead of a medical mission, it's a global health trip that's part of a 5-year agreement with 1 year that's really pretty granular about this is what you can expect from us over the next year in terms of what we're going to do in terms of service delivery and education.
So a good example of that, and correct me if I'm wrong here, like if we had just come down and there was a need for certain medications, we funneled medications to that area, we may be taking away from the pharmacist that might be trying to start up and help the economy in another way.
Yeah, this happens all the time in tons of parts of global health. Look, recently we had a request into pharmacy to help migrants on the border that were on the Mexican side of the border with very basic pharmaceutical needs. And so the system was looking at spending $10,000 on basic needs, and it was going to buy a month's worth of supply for the size refugee camp that's in Mexico. And I just said, is there a Mexican pharmacy that can provide these meds? And for 10 grand, the Mexican pharmacy can provide those meds for 6 months. And so not only are we getting a better kind of bang for our buck, but we're also supporting the local infrastructure that really needs to exist, because we could give a month's supply, put those pharmacies out of business, and then what do they do? From then on. And so, supporting local economies, economies of scale, and then also, making sure that it's part of an integrated plan is vital to the success of a global health program.
What would you say to anybody interested in global health, or, is there an approach or a conversation to global health to a person to get them involved?
Yeah, one of the best ways to do this is to sign up with the Center for Global Health's Global Health Core. It's a core group of volunteers, team members that are interested, clinical and non, that are interested in global health. And some of this is going to be continuing education, seminars, conferences, some modules that you can do to kind of further understand what global health is before you go on a trip. But also some of it is going to be local engagement. It's going to be working with our community relations departments, working with communities from the countries that we're visiting locally here in New York. But there's tons of ways to get involved. And so go on our website, email globalhealth@northwell.edu. We'll get you plugged in.
I think it's a really good growing experience for anybody, depending on how you can participate. For me, it was incredibly eye-opening because you go through with a number of emotions. You go down, getting on the plane, like, all right, I'm going to go to an area that's impoverished more than mine. And the lifestyle, I just had bought, something for my kids that I was like, they're not gonna have that down there. And feeling like, what I have, only to go there and have that totally like flipped on me of going, well, there's so many things I don't need and everybody's relatively happy with what they have. You go through a lot of growing emotions with it. So, you recommend that obviously. Was that something similar in your life?
Yeah, I think we have a lot of assumptions about what living in a more resource-constrained environment is going to look like. I think that, especially, you know, when I told people, it's less with Guyana and more with like when I was working in Botswana in Southern Africa, I'd be like, oh, I'm going to Southern Africa. And people imagine like thatched roofs, grass huts. And, you know, I was like I saw like the first Avengers movie in Botswana. I mean, so like there's definitely a level set in.
I had that too. That was me too.
Yeah,
when we went to Mamarumba and other places, it was the same thing.
Yeah, people need to kind of check their assumptions, and that's okay. It's okay to have you're going to have those biases and assumptions. Just keeping an open mind and being like, oh, this is nothing like what I thought. Just the ability to do that multiple times, I think, makes you a better healthcare provider here in the States.
Oh, 100%. You could see from everybody that was down there, I can't imagine them in their own clinical space because the dedication that they put to it, like Dr. Sugiyama, you know, seeing what he brings to this and how this is going to translate to his care, because he does take care of a large Guyanese population. Yeah. But just on a whole scale of, you know, every patient that he meets, I think it brings a different depth to them.
Yeah, and the commonality. You know, remember, Guyana is going through a change that we went through as well with the introduction of fast food, calorie-dense nutritional products, or I like to call them food-like substances. They're not really food, but they're kind of bagged, they're packaged foods. You know, so they're seeing an enormous uptake in diabetes, heart disease, high blood pressure, stroke, heart attack, kind of the things that kill, you know, the high-income world are now taking their, you know, place in the middle-income world as kind of number one cause of death. And that's been a big change over the last 30 years. We've seen deaths from infectious disease, you know, COVID kind of being exempted from this. Deaths from other infectious disease diminish as sanitation gets better, as housing gets better. But, you know, these other non-communicable diseases are on the rise everywhere because of the industrialization, because of fast food.
Yeah, the per capita of fast food places, every other block was picking up, not to name any brands, but there were a few U.S. brands that we saw routinely.
Yeah, so we export the healthcare and we export the health problems. So,
on a different topic, Ukraine.
Yeah.
What's the latest? Any breaking news with us for Ukraine? What Northwell's doing there?
Yeah, so we started a partnership with Doctors Without Borders earlier this year. We've tested that partnership early on, and Doctors Without Borders is providing direct relief in Ukraine. They've also staged in Belarus and in Russia to help support refugees going to that side of the border. We're in the process of working with the Order of Malta in Poland, which is operating 3 hospitals very close to the Ukrainian border in eastern Poland. It's a dire situation right now. It's very fluid, I'm sure, as everyone knows. It's, you know, there's new news every day. It's certainly something right now, the immediate needs of people are mostly kind of orthopedic or trauma related. But, you know, when you have 3 million people plan to go across the border into Poland, their needs are going to be incredibly complicated and they're very incredibly prolonged.
And stressed on those host countries.
Yeah, so we've been talking with the Polish government and with the nonprofits in Poland right now. I mean, you know, 3 million people, of which like 45% are expected to be children. We're thinking about, you know, what the capacity of the local healthcare system is, and it's probably not set up to take care of 1.5 million new kids and 3 million new people. And so things like GYN care, pediatric care, obstetric care are all going to be important. We're looking at how we can back up the providers that are doing excellent work in Poland. So we're working hard. We've sent 70 pallets of combat medical supplies and basic kind of human hygiene needs, things like sanitary pads and food rations and things like that, through the Ukrainian embassy to the mission to the United Nations. But we are continuing to look at ways that we can support. The second thing that I'll say is, you know, I've gotten a lot of requests about rescuing orphans, and I think this is important to say.
I brought that up in one of our team chats of like things to consider.
So you know, there's really no way to verify that a child is an orphan this early in the conflict. And so, you know, keep in mind that there's a lot of discussions about human trafficking happening at the same time as a conflict, because, you know, war brings craziness and disorder and records get lost. And so the idea of rescuing or pulling or extracting children, while it may tug at the heartstrings of getting kids away from a war zone, you may be pulling them very far away from whatever family structure they have left, and it will become increasingly more challenging to reunite them with that family structure. Yeah. And so we've got to be really slow and methodical about that. We have to protect children, and I agree that that's a major concern, but let's protect them as close to their primary family dynamic as is possible.
See, that's like the eye-opening moment that I need too, because you just react emotionally, being like, no, you know, I saw on TV, and that's what I did when I mentioned it. But then you know, there's the things that you don't really understand.
And unfortunately, the bad actors in the situation, you know, tug on those heartstrings too. And you can have very well-intentioned people participating in unknowingly in removing children from their primary support system. It's definitely something that's careful. The other thing that people don't think about and that is important, Ukraine, because of the infrastructure issues over the past decade, really, has a low measles vaccination rate. We're all focused on COVID vaccination, but measles in a malnourished refugee population, even temporarily malnourished, is the number one
right?
Yeah, it's the number one killer of children under 5. If you're going to set up refugee camps, having measles vaccination be the first thing that you do is vital. And providers that have been working in the U.S. for a long time may not recognize kind of these differences in taking care of kind of what we call forced migration populations.
Does this, something like Ukraine, also, give an opportunity to look at other conflicts around the world that, may not get the same attention?
Yeah, I think it's important. And this is something that I think, at the Center for Global Health, we've been debating how to message on this because, obviously Ukraine is unique. This is the closest that the world has come to World War III since the Cuban Missile Crisis. This is a big deal, right? Geopolitically, this is a huge deal. In terms of displaced populations, Ukraine is now one of many that have, forced migration, that have, people that are forced to leave their home. So whether you're in Syria or in Yemen or in the northern triangle of Central America, in Honduras, Guatemala, and El Salvador,
Venezuela,
in Venezuela, there are people escaping conflict all over the world. Every displaced population is an important population to pay attention to, and so we're figuring out right now how to balance our messaging by kind of emphasizing the importance of the acuity of what's going on in Ukraine with also balancing the need to respond to all of these other conflicts and all of these other displaced populations.
Well, thank you for taking the time and being with us today. I totally admire the work you're doing and the team is doing it. I'm so grateful to have been a part of it. I've been, working with you for many years, talking global health, and a lot of it doing my own research and trying to be doing a colorful spin on things. But to actually see what you're doing down there is totally admirable, and I recommend it to anybody.
I also very much appreciate you being on the trip. I know this was a at least the first trip was a big push in terms of your comfort zone. Yeah, out of your comfort zone. And being able to tell this story with the images that you capture is so captivating. And I really think it takes people who probably will never leave the country, that never want to leave the country, and gives them, even if it gives them a tenth of what you experience, I think that's valuable.
It was huge for me. It was definitely growing for me. It actually, when you texted me early February, like, ready to go back to Guyana, I was like, because I had that whole regional thing in the back of my head. It was at first originally described as helicopters. I go into these, delusions of grandeur of like, we're at the falls on the helicopter, you're hanging, So, and you're kind of a run and gun. So, but it definitely took me out of my comfort zone. It was a growing experience and something that I would like to do more of. And it's been amazing. So thank you. Thank you for inviting me to do that. And it's been great because there's so many people on our teams that want to join. Yeah. And people in the health system, through some of the work that we've done together, are seeing it firsthand. Yeah. And the engagement that we're getting from that side has been really rewarding.
Tremendous. I mean, and it's funny because as we were, the PIX11 coverage came out simultaneously with like kind of the start of the Ukraine war. And so it was a competition in my email box between I want to help out in Guyana and I want to help out in Ukraine. And it seemed like it was like 2 for 1 Guyana to Ukraine, because it was just the upswell in both employees from our health system and honestly employees from other health systems in New York that are like, my health system doesn't have this. I want to volunteer with Northwell. That's amazing when you get that level of attention. I definitely think that it's one of the most important parts of this story is how we've told it. And it's not, people say, you tell the story, why don't you just do the good work? And it's like, no, when you lead, you have to show an example as well. So it's not just about like self-aggrandizing, look at how great we are. It's like, no, we're stepping up and doing this. And this is just true for the Ukraine as well. We're stepping up and doing this. We want this to be the measuring stick. And we call upon health systems across the United States, across New York, to step up to this level of commitment. As a global citizen, this is one of our responsibilities.
For me, one of the largest things was, what a team build it is, and it's just a great growing experience for you. So I thank you, and I thank you for the work that you're doing and your team, and I wish you all the best.
Thank you so much.
HealthWish wishes to thank our very special guest, Dr. Eric Coie-Peña, Director of Global Health for the Northwell Health System. We're interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.